How to treat pelvic floor dysfunction is the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, California. Stay tuned. All right, so I've done a whole video on pelvic floor dysfunction, what that means, and then we're talking about how to treat it. Unfortunately, what is being done and what needs to be done are unfortunately not matching. A lot of times people are waiting until the symptoms are drastic, then their solution, maybe if the presentation is in the form of incontinence, they may be wearing a diaper, maybe having things inserted inside of them, practicing it. Maybe they have machines that are connected. Unfortunately, in some cases, they do catheter. I mean, it just can get really drastic. But if you do it in a timely fashion, or if unfortunately you've passed that timeline, that does not mean that, oh, it's over. It doesn't have to be. So the proper treatment for the dysfunction of the pelvic floor is very simple indeed. It first requires a proper examination and assessment involving your movement. You see, if your pelvic floor is right where I'm pointing, and if you imagine this whole area is like a bag with a top, the abdominal diaphragm is the top, the pelvic diaphragm is the bottom, and the sides are these areas of your body, and then the corners are your hip joints. So all of those play a role in the health of your pelvic floor, not just the muscles, not the function, but overall existence of it. So any tweaking, any dysfunction in any parts of it is going to throw it off. So just working on the floor of this pelvic floor function / dysfunction is only addressing a portion of it. So if you want to wait until the contents are coming out in cases of prolapse, and then you go surgically do something about it, okay, even after that surgery is done, what are you doing about the integrity of this whole bag? If you're doing therapy to address the spasm within the pelvic floor muscles, the bottom, what are you doing about the rest of it? Because with the improper and dysfunctional movement of the rest of you, with your poor posture, this muscle strengthening and work that you have done through therapy is not going to be sustained. So the proper treatment for pelvic floor dysfunction requires assessment of all of those areas, watching you perform certain specific strategic movements that involve all of these muscles picking up their load, their task, and performing. And then also, it requires an assessment of, based on your clinical symptoms, of what the actual integrity of the muscles of the pelvic floor are. Based on that, we go put everything that is dysfunctional back in function. Breathing is a huge part that is totally being disregarded, and it's absolutely necessary and foundational in the proper treatment. And then we go in and we strengthen the actual pelvic floor muscle. In our office, we have learned, let's be real, people don't like doing kegel, and then they just don't do it. So in our office, for certain cases, we actually have a machine that does 400 kegels a minute. That's not for everyone, but for those who are actually needing that, we have that jump starts them so we can get the ball rolling. So then your role becomes just maintaining what we have created together. If you enjoyed what you saw, please subscribe to the channel. If you have any questions, use one of the methods of contact in the description box to contact us. And until next time, take care.